Question 1. The evaluation methodology shows that a certified infant massage instructor, CIMI, is asked by a parent about their infant's persistent rash. The instructor has observed the rash during a massage session and has some general knowledge about common infant skin irritations. What is the most appropriate course of action for the CIMI? Option A. Recommend that the parent consult with their pediatrician or a dermatologist for a proper diagnosis and treatment plan for the rash. Option B. Provide general information about common infant skin conditions and advise the parent to monitor the rash closely. Option C. Offer to research the rash online and provide the parent with a summary of potential causes and treatments found. Option D. Suggest a specific over-the-counter cream or home remedy that has worked for other infants the instructor has encountered. Correct answer is A. Recommend that the parent consult with their pediatrician or a dermatologist for a proper diagnosis and treatment plan for the rash. Explanation. The evaluation methodology shows that a certified infant massage instructor, CIMI, faces a common implementation challenge when providing resources on infant care. This challenge lies in balancing the provision of comprehensive, accurate information with the instructor's scope of practice and the parent's individual needs and understanding. It is professionally challenging because the instructor must avoid overstepping boundaries into medical advice or diagnosis while still offering valuable support. Parents may have varying levels of prior knowledge, cultural beliefs, and specific concerns, requiring the instructor to be adaptable and sensitive. The correct approach represents best professional practice because it prioritizes evidence-based, general infant care information that is within the CIMI scope. This involves directing parents to qualified healthcare professionals for specific medical concerns, thereby upholding ethical standards and regulatory compliance by not practicing medicine without a license. It also empowers parents by providing them with reliable, accessible resources that supplement their learning and support their infant's well-being. This aligns with the ethical imperative to act in the best interest of the infant and the parent, while respecting professional boundaries. An incorrect approach that involves offering specific medical advice or diagnosing infant ailments is a significant regulatory and ethical failure. This constitutes practicing medicine without a license, which is illegal and unethical. It can lead to misdiagnosis, delayed appropriate medical care, and potential harm to the infant. Another incorrect approach, such as providing outdated or unverified information, fails to meet the standard of care expected of a certified professional and can mislead parents, potentially impacting their infant's health and development. Furthermore, ignoring a parent's specific concerns and only providing generic information without acknowledging their individual situation can be perceived as unprofessional and unsupportive, potentially eroding trust. The professional decision-making process for similar situations should involve a clear understanding of the CIMI scope of practice, which is focused on infant massage and general well-being, not medical treatment. When faced with a parent's concern that borders on or enters the medical realm, the professional should first actively listen and acknowledge the parent's concern. Then, they should clearly and gently explain that while they can offer general support and information related to infant well-being and massage, specific medical advice or diagnosis is outside their expertise and scope. The professional should then recommend that the parent consult with their pediatrician or other qualified healthcare provider for any medical concerns. Finally, the professional should offer to provide resources on general infant care topics that are within their purview, such as sleep hygiene, feeding cues, or developmental milestones, always emphasizing that these are for informational purposes and not a substitute for professional medical guidance. Question 2. The audit findings indicate that an instructor consistently applies a standard set of massage strokes to all infants within a specific age bracket, without conducting an initial assessment of each infant's current developmental stage, motor skills, or responsiveness to touch. Which of the following approaches represents best professional practice for an infant massage instructor in this scenario? Option A. Utilize a predetermined sequence of strokes that are known to promote relaxation, regardless of the infant's individual developmental milestones or cues. Option B. Observe the infant's current developmental stage, including motor skills and responsiveness to touch, and adapt massage techniques accordingly to ensure they are developmentally appropriate and beneficial. Option C. Apply a standardized set of massage strokes that are generally considered safe for the specified age bracket, assuming all infants develop at a similar pace. Option D. focus primarily on the caregiver's comfort level with the massage techniques, as their confidence is paramount to a positive experience. Correct answer is B. Observe the infant's current developmental stage, including motor skills and responsiveness to touch, and adapt massage techniques accordingly to ensure they are developmentally appropriate and beneficial. Explanation. The audit findings highlight a common challenge in infant massage instruction, ensuring that instructors accurately assess and respond to the developmental needs of infants, which can vary significantly even within a narrow age range. This requires a nuanced understanding beyond simple chronological age. The professional challenge lies in translating theoretical knowledge of developmental stages into practical, individualized instruction that is safe, effective, and respectful of each infant's unique pace and cues. Misinterpreting developmental stages can lead to inappropriate techniques, potentially causing discomfort or hindering the infant's engagement, and failing to meet the instructor's ethical obligation to promote infant well-being. The correct approach demonstrates best professional practice by prioritizing an individualized assessment of the infant's current developmental stage and responsiveness before applying massage techniques. This aligns with the ethical imperative of client-centered care and the CIMI responsibility to adapt instruction to the specific needs of each infant and caregiver. By observing the infant's cues, motor skills, and sensory engagement, instructor can select appropriate massage strokes and timing that are developmentally supportive, fostering a positive and beneficial experience. This proactive, observational approach ensures that the massage is not only safe, but also maximally beneficial for the infant's development and the caregiver's bonding. An incorrect approach that focuses solely on chronological age without considering individual variation fails to acknowledge the spectrum of infant development. This can lead to the application of techniques that are either too advanced or too basic for the infant, potentially causing overstimulation or understimulation, and thus not optimizing the benefits of infant massage. Ethically, this represents a failure to provide tailored instruction and a disregard for the infant's immediate needs and capabilities. Another incorrect approach that relies on a generalized set of techniques for a broad age group, without observing the infant's current developmental markers, overlooks the dynamic nature of infant development. This can result in techniques that are not developmentally appropriate, potentially leading to frustration for the infant or caregiver, and failing to capitalize on the infant's readiness for specific types of touch and stimulation. This approach is ethically problematic as it prioritizes a standardized protocol over individualized care. A further incorrect approach that assumes all infants within a given age range will respond identically to massage ignores the inherent variability in infant development. This can lead to a missed opportunity to adapt the massage to the infant's specific cues and developmental progress, potentially limiting the effectiveness of the intervention and failing to meet the instructor's duty of care to provide the most beneficial experience. The professional reasoning process for similar situations should involve a continuous cycle of observation, assessment, adaptation, and evaluation. Instructors must first understand the general developmental milestones for different age groups. However, they must then actively observe the individual infant for cues related to their current motor skills, alertness, and responsiveness. Based on this assessment, they should select and adapt massage techniques that are appropriate for that infant's present developmental stage. Finally, they must continuously evaluate the infant's response to the massage and be prepared to adjust their approach accordingly, ensuring the massage remains a positive and developmentally supportive experience. Question 3. The risk matrix shows a moderate likelihood of parental anxiety regarding the effectiveness of specific infant massage strokes for addressing common infant discomforts like colic and gas. As a certified infant massage instructor, CIMI, you are tasked with demonstrating and explaining the purpose of various strokes to a group of new parents. Which of the following approaches best addresses this challenge while adhering to professional and ethical guidelines? Option A. Focus on demonstrating a wide variety of advanced strokes without detailed explanation, assuming parents will intuitively understand their benefits for colic and gas. Option B. Advise parents that specific strokes are guaranteed to cure their infant's colic and gas, and that massage is a direct medical treatment for these conditions. Option C. Recommend strokes based on personal anecdotes and popular trends, without verifying their underlying principles or potential contraindications for infant comfort. Option D. Demonstrate the effleurage, stroke for general relaxation and improved circulation, and the windmill and I love you strokes specifically for aiding in the relief of infant gas and digestive discomfort, explaining how these movements can stimulate the digestive system and promote comfort. The correct answer is D. Demonstrate the effleurage, stroke for general relaxation and improved circulation, and the windmill and I love you, strokes specifically for aiding in the relief of infant gas and digestive discomfort, explaining how these movements can stimulate the digestive system and promote comfort. Explanation. The risk matrix shows a moderate likelihood of parental anxiety regarding the effectiveness of specific infant massage strokes for addressing common infant discomforts like colic and gas. This scenario is professionally challenging because it requires the certified infant massage instructor, CIMI, to not only demonstrate technical proficiency in various strokes, but also to articulate their physiological and psychological benefits in a way that is both accurate and reassuring to parents, without making unsubstantiated medical claims. Instructor must navigate the fine line between providing helpful information and offering medical advice, which falls outside their scope of practice. The correct approach represents best professional practice because it prioritizes evidence-informed techniques and clear, parent-centered communication. By focusing on the effleurage stroke for relaxation and the windmill and I love you strokes for gas relief, the instructor addresses common parental concerns directly, explaining the purpose of each stroke in terms of promoting circulation, stimulating the parasympathetic nervous system, and aiding digestion aligns with the established understanding of infant massage benefits. This approach is ethically sound as it provides practical, supportive guidance within the CIMI scope, empowering parents with tools to comfort their infants. It avoids making definitive medical claims, instead focusing on supportive care and parental bonding. An incorrect approach that focuses solely on demonstrating strokes without explaining their purpose or benefits fails to meet the informational needs of anxious parents and misses an opportunity to build confidence. This could be perceived as a lack of expertise or empathy, potentially leading parents to seek unverified information elsewhere. Another incorrect approach that involves making specific medical claims about curing colic or gas is a significant regulatory and ethical failure. CIMI are not medical professionals and are prohibited from diagnosing or treating medical conditions. Such claims could lead to a false sense of security for parents, potentially delaying appropriate medical consultation if needed, and expose the instructor to liability. A further incorrect approach that involves recommending strokes based on anecdotal evidence without understanding their underlying principles or potential contraindications is also professionally unacceptable. While anecdotal evidence can be a starting point, best practice requires grounding recommendations in established techniques and understanding their intended effects, ensuring safety and efficacy. The professional decision-making process for similar situations involves a continuous cycle of assessment, planning, implementation, and evaluation. A CIMI should first assess parental concerns and the infant's needs. Then, they should plan to address these concerns using appropriate, evidence-informed infant massage techniques, clearly articulating the purpose and expected benefits of each stroke. Implementation involves demonstrating and explaining these strokes in a supportive and clear manner, always within the scope of practice. Finally, evaluation involves observing the parent's understanding and the infant's response, and being prepared to offer further guidance or suggest seeking professional medical advice when necessary. This iterative process ensures that the instruction provided is safe, effective, and ethically sound. Question 4. The performance metrics show a consistent pattern of parental feedback, indicating that infants in a particular class exhibit noticeable stiffness in their legs during massage sessions, with parents specifically mentioning difficulty in achieving full range of motion during certain strokes. As a certified infant massage instructor, CIMI, you observe this as well. What is the most appropriate course of action? Option A. Recommend that the parents consult with their pediatrician or a qualified healthcare professional for a thorough assessment of the infant's musculoskeletal development and any potential underlying causes for the observed stiffness. Option B. Demonstrate and instruct the parents on specific stretching exercises you believe will help loosen the infant's leg muscles, as this is a common issue you've encountered. Option C. Modify the massage routine to focus exclusively on areas where the infant shows no stiffness, avoiding any strokes that might elicit discomfort or resistance in the legs. Option D. Inform the parents that this level of stiffness is common in infants and encourage them to continue with the standard massage routine, as it will naturally resolve over time. The correct answer is A. Recommend that the parents consult with their pediatrician or a qualified healthcare professional for a thorough assessment of the infant's musculoskeletal development and any potential underlying causes for the observed stiffness. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the certified infant massage instructor, CIMI, to balance the immediate needs of an infant with potential underlying musculoskeletal concerns, all while adhering to professional scope of practice and ethical guidelines. The instructor must recognize the limitations of their role and the importance of seeking appropriate medical advice without overstepping boundaries or causing undue alarm. Correct approach analysis. The correct approach prioritizes the infant's well-being and safety by recommending consultation with a pediatrician. This aligns with the CIMI professional scope, which focuses on providing comfort, promoting bonding, and supporting development through massage techniques. It is ethically imperative to recognize when a situation may require medical expertise beyond the instructor's training. This approach upholds the principle of do no harm by ensuring any potential musculoskeletal issues are properly assessed by a qualified healthcare professional. It also respects the parent's role in making healthcare decisions for their child. Incorrect approaches analysis. One incorrect approach involves proceeding with a specific massage technique to address the perceived stiffness. This is professionally unacceptable because it constitutes practicing medicine or physical therapy without a license. The CIMI is not qualified to diagnose or treat musculoskeletal conditions. This action could potentially exacerbate an underlying issue or delay necessary medical intervention, violating ethical standards and potentially legal regulations regarding the practice of healthcare. Another incorrect approach is to dismiss the parent's observation and continue with the standard massage routine as if no concern was raised. This is ethically problematic as it disregards the parent's intuition and the infant's potential discomfort. It fails to acknowledge the importance of a holistic approach to infant care and can erode trust between the instructor and the family. While not a direct violation of medical practice, it demonstrates a lack of professional diligence and empathy. A third incorrect approach is to offer a diagnosis or suggest specific exercises for the infant's legs. This directly crosses the line into medical diagnosis and treatment, which is outside the CIMI scope of practice. It is a serious ethical and potentially legal breach, as it misrepresents the instructor's qualifications and could lead to inappropriate self-treatment by the parents, with potentially harmful consequences for the infant. Professional reasoning. When faced with observations or concerns that suggest a potential medical issue, a CIMI should employ a decision-making process that involves 1. Active listening, fully understanding the parent's observations and concerns. 2. Scope of practice awareness, clearly identifying what falls within the CIMI expertise and what requires referral. 3. Prioritization of safety, ensuring the infant's well-being is the paramount concern. 4. Clear communication, articulating recommendations in a supportive and non-alarming manner, emphasizing the importance of professional medical evaluation. 5. Documentation, maintaining records of observations and recommendations made. Question 5. Cost-benefit analysis shows that while some parents may desire a specific massage technique they believe will offer rapid calming, a certified infant massage instructor, CIMI, must prioritize the infant's physiological well-being. Considering the delicate nature of an infant's cardiovascular and respiratory systems, which of the following actions best reflects adherence to the CIMI regulatory framework and ethical best practices? Option A. Apply deep, firm pressure to the infant's abdomen and chest to mimic the requested technique, believing that intensity is key to achieving the desired calming effect. Option B. Focus exclusively on superficial strokes that do not involve any direct manipulation of the infant's torso, to avoid any potential respiratory or cardiovascular interference, even if it means omitting common and beneficial massage practices. Option C. Gently demonstrate and explain the physiological benefits of the requested technique, but proceed only with techniques that are recognized as safe and appropriate for infants by the CIMI curriculum, ensuring the infant's breathing and heart rate remain stable and comfortable. Option D. Immediately implement the requested massage technique as described by the parent, assuming their understanding of their infant's needs is superior to the instructor's formal training. The correct answer is C. Gently demonstrate and explain the physiological benefits of the requested technique, but proceed only with techniques that are recognized as safe and appropriate for infants by the CIMI curriculum, ensuring the infant's breathing and heart rate remain stable and comfortable. Explanation: this scenario presents a professional challenge because it requires an infant massage instructor to balance the perceived benefits of a specific massage technique with the potential physiological risks to an infant, particularly concerning their developing cardiovascular and respiratory systems. The instructor must rely on evidence-based practice and establish safety guidelines, rather than anecdotal evidence or personal preference, to ensure infant well-being. The correct approach represents best professional practice because it prioritizes the infant's physiological safety and developmental stage. Adhering to established guidelines for infant massage, which are informed by pediatric physiology, ensures that techniques used are appropriate and do not place undue stress on the infant's immature cardiovascular and respiratory systems. This aligns with the ethical imperative to do no harm and the professional responsibility to provide safe and effective instruction. The regulatory framework for certified infant massage instructors, CIMI, emphasizes evidence-based practices and safety protocols, which are designed to protect infants. An incorrect approach that involves applying deep abdominal pressure, for instance, would be a significant regulatory and ethical failure. Such a technique could impede diaphragmatic breathing, leading to respiratory distress, or negatively impact circulation in a vulnerable infant. This directly contravenes the safety guidelines that CIMI certification upholds. Similarly, using vigorous strokes that could elevate the infant's heart rate beyond a safe and comfortable range, without considering the infant's individual cues or developmental stage, would also be a failure. This disregards the physiological limitations of infants and the principles of gentle, responsive touch that are fundamental to infant massage. Relying solely on parental requests for specific techniques without assessing their appropriateness for the infant's physiological state is another ethical lapse, as the instructor's primary duty is to the infant's safety and well-being. The professional decision-making process for similar situations should involve a thorough assessment of the infant's current state, including their breathing patterns and general demeanor. The instructor must consult and adhere to the established curriculum and safety guidelines of the CIMI certification. If a parent requests a technique that appears questionable or potentially harmful, the instructor should engage in open communication, explaining the rationale behind recommended practices and addressing any concerns with evidence-based information. The ultimate decision must always be guided by the infant's physiological safety and the principles of responsible infant care. Question 6. Operational review demonstrates a parent attending a certified infant massage instructor (CIMI) session expresses concern that a specific leg massage stroke, as demonstrated by the instructor, feels too firm for their baby, suggesting a lighter, more generalized stroking motion based on advice from a relative. The instructor must decide how to respond. Option A. Inform the parent that the instructor's method is the only correct way and that they must follow it precisely. Option B. Immediately adopt the parent's suggested lighter, generalized stroking motion for the legs to accommodate their comfort level. Option C. Gently explain the rationale behind the specific leg stroke, emphasizing its benefits for muscle development and circulation, and offer to demonstrate it again, guiding the parent's hand to ensure appropriate pressure. Option D. Suggest the parent research alternative infant massage techniques online and implement those instead. Correct answer is C. Gently explain the rationale behind the specific leg stroke, emphasizing its benefits for muscle development and circulation, and offer to demonstrate it again, guiding the parent's hand to ensure appropriate pressure. Explanation: the scenario presents a common challenge for certified infant massage instructors, CIMI, where a parent expresses a desire to deviate from established, evidence-based infant massage techniques due to anecdotal advice. This is professionally challenging because the CIMI must balance respecting parental autonomy with their responsibility to provide safe, effective, and developmentally appropriate instruction, adhering strictly to the CIMI ethical guidelines and scope of practice. The core of the challenge lies in navigating parental concerns while upholding professional standards. The correct approach represents best professional practice because it prioritizes the infant's well-being and safety, aligning with the foundational principles of infant massage instruction. By gently educating the parent on the rationale behind the recommended techniques, emphasizing their benefits and safety, and offering to demonstrate and guide them through the correct application, the CIMI upholds their commitment to evidence-based practice. This approach respects the parent's concerns without compromising the integrity of the instruction or the infant's safety, reinforcing the CIMI role as a trusted educator. This aligns with the ethical imperative to act in the best interest of the infant and to provide accurate, reliable information. An incorrect approach that involves immediately adopting the parent's suggested technique without question would be professionally unacceptable. This failure stems from a disregard for the established safety protocols and developmental considerations inherent in infant massage, could lead to discomfort or even harm to the infant, violating the CIMI duty of care and potentially contravening guidelines that emphasize gentle, age-appropriate touch. Another incorrect approach, that of dismissing the parent's concerns outright and rigidly insisting on the standard method without explanation, is also professionally unacceptable. While adhering to best practices is crucial, a lack of empathy and communication can alienate the parent, undermine trust, and prevent them from fully engaging with the beneficial aspects of infant massage. This approach fails to acknowledge the parent's role in their child's care and can be perceived as unsupportive, hindering the positive parent-infant connection that infant massage aims to foster. The professional decision-making process for similar situations should involve a framework of 1. Active listening and empathy. Understand the parent's concern and acknowledge their perspective. 2. Education and rationale. Clearly explain the why behind recommended techniques, referencing safety and developmental benefits. 3. Demonstration and guidance. Offer to show the correct technique and provide hands-on support. 4. Collaborative problem solving. If a minor, safe modification is possible and beneficial, explore it collaboratively. 5. Upholding scope of practice. If the parent's suggestion falls outside safe or appropriate practice, gently but firmly explain the limitations and reaffirm the commitment to the infant's well-being. Question 7. Assessment of how a certified infant massage instructor CIMI should modify their approach when teaching massage techniques to a 6-month-old infant compared to a 1-month-old infant, considering the infant's developmental stage and responsiveness. Option A. Increasing the duration of each stroke and introducing more complex patterns without observing the infant's reaction, assuming older infants can tolerate more stimulation. Option B. Applying the identical sequence and pressure of strokes used for a newborn, as the fundamental principles of infant massage remain constant regardless of age. Option C. Adjusting stroke pressure and rhythm to accommodate the older infant's increased muscle tone and mobility, while remaining attentive to their cues for engagement or disengagement. Option D. Focusing solely on passive range of motion exercises, as active participation is expected to increase significantly with age, making traditional massage strokes less relevant. The correct answer is C. Adjusting stroke pressure and rhythm to accommodate the older infant's increased muscle tone and mobility, while remaining attentive to their cues for engagement or disengagement. Explanation. The scenario presents a common challenge for certified infant massage instructors, CIMI, adapting established techniques to the developmental stages of infants. This requires a nuanced understanding of infant physiology, behavior, and the specific guidelines of the CIMI certification, which are rooted in best practices for infant well-being and safety. The professional challenge lies in balancing the core principles of infant massage with the evolving needs and capabilities of infants as they grow. Careful judgment is required to ensure techniques are not only effective, but also appropriate and safe for each age group, respecting the infant's cues and developmental milestones. The correct approach represents best professional practice because it prioritizes the infant's individual developmental stage and responsiveness. This aligns with the ethical imperative of a CIMI to provide safe, nurturing, and developmentally appropriate instruction. By observing the infant's cues and adjusting strokes accordingly, the instructor demonstrates a commitment to the infant's comfort and learning, which is a cornerstone of effective infant massage instruction. This approach is implicitly supported by the general principles of infant care and developmental psychology, which emphasize responsiveness and individualization. An incorrect approach that involves applying the exact same strokes and pressure intended for a newborn to an older infant who is more mobile and has different muscle tone would be professionally unacceptable. This fails to acknowledge developmental progression and could lead to discomfort or ineffectiveness of the massage. Ethically, it disregards the infant's changing needs and could be perceived as a lack of expertise or attentiveness. Another incorrect approach, such as rigidly adhering to a preset routine without considering the infant's current mood or energy level, also demonstrates a failure to adapt. This can lead to resistance from the infant, making the massage experience negative rather than beneficial. It overlooks the dynamic nature of infant interaction and the importance of attunement. Professionals should employ a decision-making framework that begins with a thorough understanding of the infant's age and developmental stage. This is followed by careful observation of the infant's cues, their body language, vocalizations, and overall engagement. The instructor then applies their knowledge of CIMI techniques, adapting pressure, rhythm, and stroke selection based on the observed cues and developmental stage. This iterative process of observation, adaptation, and application ensures that the massage remains a positive and beneficial experience for both the infant and the caregiver. Question 8. Comparative studies suggest that while a variety of oils and lotions are marketed for infant use, the safety and efficacy for infant massage can vary significantly. As a certified infant massage instructor, you are advising a group of new parents on the best practices for selecting and using oils for massage. Considering the delicate nature of infant skin and the potential for adverse reactions, which of the following approaches represents the most responsible and safest recommendation for general use? Option A. Advise parents to use mineral oil or petroleum jelly, as these are effective at creating a barrier on the skin and preventing moisture loss. Option B. Suggest using any readily available baby lotion, as these products are generally formulated for infant skin and are considered safe for everyday use. Option C. Recommend oils that contain natural fragrances or a small percentage of essential oils, as these can enhance the sensory experience for both parent and infant. Option D. Recommend pure, unadulterated plant-based oils known for their hypoallergenic properties, such as organic fractionated coconut oil or grapeseed oil, advising parents to perform a patch test on a small area of the infant's skin before full application, and to observe for any signs of irritation. Correct answer is D. Recommend pure, unadulterated plant-based oils known for their hypoallergenic properties, such as organic fractionated coconut oil or grapeseed oil, advising parents to perform a patch test on a small area of the infant's skin before full application, and to observe for any signs of irritation. Explanation. Scenario analysis. This scenario presents a common implementation challenge for certified infant massage instructors, CIMI. Parents often have varying levels of knowledge and access to different products, leading to potential safety concerns regarding the oils and lotions used for infant massage. The challenge lies in providing clear, evidence-based, and universally applicable recommendations that prioritize infant safety while respecting parental choices and available resources. A CIMI must navigate potential misinformation, allergies, and the specific needs of delicate infant skin. Correct approach analysis. The correct approach emphasizes the use of pure, unadulterated plant-based oils that are hypoallergenic and have a low risk of irritation or allergic reaction. This aligns with the core principles of infant safety and best practices in infant care. Specifically, recommending oils like organic fractionated coconut oil, grapeseed oil, or sweet almond oil, with appropriate patch testing for nut allergies, is supported by their minimal processing, lack of additives, and historical use in infant skincare. These oils are readily absorbed, moisturize effectively, and are generally considered safe for sensitive infant skin. The emphasis on patch testing and observing for adverse reactions is a crucial safety protocol that empowers parents to monitor their infant's response. This approach is ethically sound as it prioritizes the infant's well-being above all else, and is consistent with general guidelines for infant skincare and massage. Incorrect approaches analysis. Recommending oils with added fragrances or essential oils is a significant regulatory and ethical failure. Many fragrances and essential oils, even those marketed as natural, can be potent irritants or allergens for infants, leading to skin reactions, respiratory issues, or even systemic absorption concerns. Regulatory bodies and pediatric associations generally advise against the use of fragrance products on infants. Suggesting the use of mineral oil or petroleum jelly presents another regulatory and ethical concern. While these are occlusive and can moisturize, they are petroleum-derived and can potentially clog pores, leading to breakouts or hindering the skin's natural barrier function. Furthermore, some concerns exist regarding the purity and potential contaminants in certain mineral oil products. While not as acutely dangerous as essential oils, they are not considered the optimal choice for infant massage due to potential long-term effects and the availability of safer, plant-based alternatives. Advocating for the use of any readily available baby lotion without specific consideration for ingredients is also professionally unacceptable. Many commercial baby lotions contain a cocktail of preservatives, emulsifiers, and synthetic fragrances that can be irritating or allergenic to an infant's sensitive skin. A CIMI has a responsibility to guide parents toward products with the simplest, safest ingredient lists, rather than relying on broad marketing claims. Professional reasoning. When faced with decisions about oils and lotions for infant massage, a CIMI should employ a decision-making process that prioritizes infant safety and evidence-based recommendations. This involves 1. Understanding the core principles of infant skin sensitivity and the potential risks associated with various ingredients. 2. Consulting current, reputable guidelines from pediatric organizations and dermatological associations regarding infant skincare. 3. Prioritizing pure, single-ingredient plant-based oils with a low allergenic potential. 4. Educating parents on the importance of patch testing and observing for any adverse reactions. 5. Clearly communicating the rationale behind recommendations, explaining why certain ingredients or product types are advised against. 6. Maintaining a commitment to continuous learning and staying updated on research and best practices in infant care. Question 9. Compliance review shows that during a routine infant massage session, an infant begins to show signs of fussiness and mild distress, including squirming and vocalizations that suggest discomfort. The instructor is midway through a planned sequence of leg strokes. What is the most appropriate and professionally responsible course of action for the certified infant massage instructor, CIMI, to take? Option A. Gently transition to a more calming and comforting stroke, such as a gentle back stroke or a full body embrace, while continuing to observe the infant's cues closely. Option B. Immediately stop the massage and offer a pacifier or begin rocking the infant to soothe them, as massage may be contributing to their distress. Option C. Continue with the planned leg strokes, assuming the infant will eventually settle down as they become more accustomed to the massage. Option D. Increase the pressure and speed of the leg strokes to try and work through the infant's fussiness and encourage them to relax. The correct answer is A. Gently transition to a more calming and comforting stroke, such as a gentle back stroke or a full body embrace, while continuing to observe the infant's cues closely. Explanation. This scenario presents a professional challenge because it requires an infant massage instructor to balance the immediate needs of a distressed infant with the established best practices and safety guidelines for infant massage. The instructor must make a judgment call that prioritizes the infant's well-being while adhering to the principles of infant massage instruction. The correct approach represents best professional practice because it directly addresses the infant's distress through a gentle, responsive technique that is a recognized component of infant massage. This approach is ethically sound as it prioritizes the infant's comfort and safety above all else. It aligns with the core principles of infant massage, which emphasize responsiveness to the infant's cues and creating a nurturing, secure environment. This method is also consistent with the regulatory framework for certified infant massage instructors, CIMI, which mandates that instructors act in the best interest of the infant and follow established safety protocols. An incorrect approach that involves immediately stopping the massage and attempting to soothe the infant with non-massage related activities, such as offering a pacifier or rocking, fails to acknowledge the potential benefits of continuing a modified massage. While soothing is important, abruptly ceasing massage without attempting to adapt the technique could be seen as a missed opportunity to use a therapeutic tool. This could be interpreted as a failure to fully utilize the skills and knowledge expected of a CIMI, potentially leading to a less optimal outcome for the infant's comfort. Another incorrect approach, such as continuing with the planned massage routine without any modification or acknowledgement of the infant's distress, represents a significant regulatory and ethical failure. This demonstrates a lack of responsiveness to the infant's cues, which is a fundamental principle of infant massage. It could lead to further distress for the infant and potentially create a negative association with massage. This approach disregards the infant's immediate needs and the instructor's responsibility to adapt their practice accordingly, violating the ethical obligation to provide safe and appropriate care. A further incorrect approach, such as immediately escalating to more vigorous massage techniques to overcome the distress, is also a critical failure. This is not only ineffective but potentially harmful. Vigorous techniques are generally contraindicated for distressed infants and can exacerbate their discomfort, leading to a breach of safety protocols and a failure to act in the infant's best interest. This demonstrates a misunderstanding of infant massage principles and a disregard for the infant's physiological and emotional state. The professional decision-making process for similar situations should involve a rapid assessment of the infant's cues, a consideration of the most appropriate and gentle massage techniques that can be adapted to the infant's current state, and a commitment to prioritizing the infant's comfort and safety. Professionals should always be prepared to modify their approach based on the infant's responses, rather than rigidly adhering to a predetermined plan. This involves a continuous feedback loop of observation, adaptation, and reevaluation. Question 10. To address the challenge of an infant presenting with visibly red, slightly raised patches on their cheeks and neck during a scheduled infant massage session, which appears to be exacerbated by the initial light touch, what is the most appropriate course of action for a certified infant massage instructor, CIMI? Option A. Gently discontinue the massage for the day, advise the parent to observe the skin, and recommend consulting their pediatrician or a qualified healthcare provider for assessment and guidance before resuming massage. Option B. Continue with the full standard massage routine, assuming the redness is a normal reaction to touch and will subside on its own. Option C. Proceed with a modified, lighter massage routine, focusing only on areas not exhibiting redness, and suggest the parent try a different brand of massage oil. Option D. Immediately stop the massage and advise the parent to apply a specific over-the-counter hydrocortisone cream to the affected areas. The correct answer is A. Gently discontinue the massage for the day, advise the parent to observe the skin, and recommend consulting their pediatrician or a qualified healthcare provider for assessment and guidance before resuming massage. Explanation. The scenario presents a common challenge for certified infant massage instructors, CIMI, where an infant exhibits signs of skin sensitivity, requiring a nuanced and informed approach that prioritizes the infant's well-being and adheres to professional standards. The challenge lies in distinguishing between normal infant skin variations and potential underlying issues that could be exacerbated by massage, necessitating a careful assessment and a tailored response. The correct approach represents best professional practice because it prioritizes the infant's safety and comfort by recommending consultation with a healthcare professional. This aligns with the ethical responsibility of a CIMI to recognize the limits of their scope of practice and to ensure that any concerns regarding an infant's health are addressed by qualified medical personnel. This proactive step prevents potential harm and ensures the infant receives appropriate care, upholding the CIMI commitment to the infant's welfare. An incorrect approach that involves proceeding with a standard massage routine without further assessment fails to acknowledge the infant's specific needs and the potential risks associated with sensitive skin. This could lead to irritation, discomfort, or the exacerbation of an underlying skin condition, violating the principle of do no harm and potentially contravening guidelines related to infant care and safety. Another incorrect approach, which is to discontinue massage altogether without seeking professional advice, might be overly cautious and deprive the infant of the potential benefits of infant massage. While safety is paramount, a blanket refusal without understanding the cause of the sensitivity may not be the most beneficial course of action for the infant and parent. A third incorrect approach, which is to recommend specific over-the-counter remedies or treatments, falls outside the CIMI scope of practice. Providing medical advice or product recommendations for skin conditions is the domain of healthcare professionals and can lead to inappropriate treatment or masking of serious issues. The professional decision-making process for similar situations involves a systematic evaluation. First, observe and assess the infant's skin condition and any accompanying signs of distress. Second, consider the infant's medical history and any known sensitivities. Third, determine if the observed condition falls within the CIMI scope of practice or requires referral to a healthcare professional. Fourth, communicate clearly and empathetically with the parent or caregiver, explaining the assessment and the recommended course of action. Finally, document the assessment and the plan. Question 11. The efficiency study reveals that while instructors are proficient in massage techniques, there is a notable variation in the thoroughness of pre-massage hand sanitization procedures among certified infant massage instructors, CIMI. Considering the vulnerability of infants, which of the following approaches to hand sanitization best aligns with the regulatory framework and ethical obligations of a CIMI? Option A. Washing hands with soap and water for approximately 10 seconds, focusing only on the palms, before and after each infant massage session. Option B. Using an alcohol-based hand sanitizer that kills most germs, applying it liberally to all hand surfaces and rubbing until dry, before and after each infant massage session. Option C. A quick rinse of hands under running water without soap, followed by air drying before and after each infant massage session. Option D. Thoroughly washing hands with soap and water for at least 20 seconds, ensuring all surfaces of the hands are scrubbed, followed by drying with a clean towel before and after each infant massage session. The correct answer is D. Thoroughly washing hands with soap and water for at least 20 seconds, ensuring all surfaces of the hands are scrubbed, followed by drying with a clean towel before and after each infant massage session. Explanation. The efficiency study reveals that while many certified infant massage instructors, CIMI, are adept at demonstrating massage techniques, there is variability in their adherence to stringent hygiene protocols. This scenario is professionally challenging because infant skin is highly sensitive and their immune systems are still developing, making them particularly vulnerable to infections. A lapse in hygiene can have serious health consequences for the infant, ranging from minor skin irritations to more severe systemic infections. Therefore, meticulous judgment is required to ensure the highest standards of safety are maintained at all times. The correct approach represents best professional practice because it prioritizes the infant's well-being above all else, aligning with the core ethical principles of infant care and the implicit regulatory framework of ensuring a safe environment for vulnerable populations. This approach involves a comprehensive understanding and consistent application of hygiene guidelines, including thorough hand-washing before and after each session, ensuring the massage surface is clean and disinfected, and using clean, appropriate materials. This proactive stance minimizes the risk of pathogen transmission and demonstrates a commitment to professional responsibility and client safety, which are paramount in the CIMI profession. An incorrect approach that involves minimal hand-washing, perhaps only a quick rinse, fails to adequately remove transient microorganisms, posing a significant risk of transmitting pathogens to the infant. This is a direct violation of basic hygiene principles essential for infant care and can be considered an ethical failure due to negligence. Another incorrect approach might be using a massage surface that has not been properly disinfected between clients, which creates a breeding ground for bacteria and viruses, leading to potential cross-contamination and infection. This demonstrates a lack of understanding of infection control protocols and a disregard for the infant's health, constituting a serious professional and ethical lapse. A third incorrect approach could be the use of personal items, such as jewelry or long, unvarnished fingernails, during massage, which can harbor bacteria and cause accidental abrasions to the infant's delicate skin. This highlights a failure to recognize and mitigate common hygiene hazards, leading to an unsafe practice. Professionals should employ a decision-making framework that begins with a thorough understanding of established hygiene protocols for infant care. This involves continuous education and staying updated on best practices. When faced with a situation, the professional should always err on the side of caution, prioritizing the infant's safety. This means consistently performing all required hygiene steps, even if it seems time-consuming or inconvenient. A self-assessment checklist for hygiene before and after each session can be a valuable tool. Furthermore, fostering an environment where questioning and reinforcing hygiene practices among colleagues is encouraged can help maintain high standards across the profession. Question 12. The monitoring system demonstrates a parent arriving for an infant massage session with their baby who appears lethargic and has a visibly flushed face. The parent expresses a strong desire to proceed with the massage, stating they believe it will help their baby feel better. The CIMI observes the infant's condition and suspects a fever. What is the most appropriate course of action for the CIMI? Option A. Immediately inform the parent that the session cannot proceed and ask them to leave without further explanation. Option B. Gently explain to the parent that due to the infant's suspected fever, it is not safe to proceed with massage at this time and suggest rescheduling once the infant has recovered, offering to provide information on supportive care in the interim. Option C. Proceed with a very light, modified massage, focusing only on areas that do not seem affected by the fever to accommodate the parent's request. Option D. Advise the parent to consult their pediatrician and then proceed with the massage as planned, assuming the pediatrician would have advised them if it were unsafe. The correct answer is B. Gently explain to the parent that due to the infant's suspected fever, it is not safe to proceed with massage at this time, and suggest rescheduling once the infant has recovered, offering to provide information on supportive care in the interim. Explanation. This scenario presents a professional challenge because it requires the certified infant massage instructor, CIMI, to balance the parent's stated desire with the paramount need for infant safety and well-being, adhering strictly to established safety guidelines. The instructor must exercise professional judgment to assess the situation and determine the most appropriate course of action, prioritizing the infant's health over parental preference when a conflict arises. The correct approach represents best professional practice because it upholds the core ethical and safety principles of infant massage instruction. By gently but firmly explaining the contraindication for massage due to the infant's fever, the instructor is acting in accordance with established safety guidelines that protect vulnerable infants from potential harm. This aligns with the CIMI responsibility to provide safe and effective instruction, ensuring that the practice does not exacerbate existing health issues. The instructor's action demonstrates a commitment to the infant's welfare, which is the highest ethical consideration in this context. An incorrect approach that involves proceeding with a modified massage despite the fever is professionally unacceptable. This failure constitutes a direct violation of safety guidelines, as massaging an infant with a fever can potentially increase body temperature, cause discomfort, or mask a worsening condition. Ethically, it prioritizes parental request over the infant's health, which is a dereliction of the instructor's duty of care. Another incorrect approach, such as immediately terminating the session without explanation, is also problematic. While safety is paramount, a lack of clear, empathetic communication can undermine trust and the parent's understanding of the rationale, potentially leading to future misunderstandings or a reluctance to seek guidance. This approach lacks the educational component expected of a certified instructor. A third incorrect approach, such as suggesting the parent consult a pediatrician without offering any immediate guidance on massage safety, fails to provide the direct support and expertise the parent sought from the CIMI, thereby not fully fulfilling the instructor's role in this specific interaction. Professionals should employ a decision-making framework that begins with identifying the core issue, infant's health status vs. parental request. Next, they must consult and apply relevant safety guidelines and ethical principles. This is followed by assessing the immediate risks and benefits of each potential action. The instructor should then communicate their decision clearly and empathetically, explaining the rationale based on safety guidelines. Finally, they should offer alternative solutions or appropriate next steps, such as rescheduling the session once the infant has recovered. Question 13. Market research demonstrates that parents attending infant massage classes often express anxieties and concerns in varied ways, sometimes through indirect questioning or by sharing personal anecdotes that may not directly relate to the immediate massage technique being taught. As a certified infant massage instructor, CIMI, you are demonstrating a specific massage stroke to a new parent who is repeatedly asking tangential questions about sleep patterns and feeding schedules, appearing distracted. What is the most effective communication technique to address this situation while ensuring the parent feels supported and the learning objectives are met? Option A. Ignore the parent's tangential questions and continue with the demonstration, assuming they will eventually focus on the massage technique. Option B. Directly interrupt the parent's tangential questions and firmly state, "We need to stay focused on the massage technique. Your questions about sleep and feeding are not relevant to this lesson." Option C. Acknowledge the parent's broader concerns about their infant's well-being. Gently redirect by stating, "Those are very important topics and we can certainly discuss them further after we've covered this massage stroke. For now, let's focus on how to gently stroke your baby's legs to promote relaxation, while maintaining eye contact and a reassuring tone." Option D. Agree to pause the demonstration and engage in a lengthy discussion about sleep and feeding, hoping to address all the parent's concerns before returning to the massage technique. Correct answer is C. Acknowledge the parent's broader concerns about their infant's well-being. Gently redirect by stating, "Those are very important topics, and we can certainly discuss them further after we've covered this massage stroke. For now, let's focus on how to gently stroke your baby's legs to promote relaxation, while maintaining eye contact and a reassuring tone." Explanation. This scenario is professionally challenging because it requires an infant massage instructor to navigate a situation where a parent's communication style may inadvertently create a barrier to effective learning and bonding during a crucial developmental period for their infant. The instructor must balance the parent's needs and comfort with the primary goal of promoting safe and beneficial infant massage practices. Careful judgment is required to ensure the parent feels supported and understood, while also upholding professional standards and the well-being of the infant. The correct approach represents best professional practice because it prioritizes open, empathetic, and non-judgmental communication. By actively listening, validating the parent's feelings, and offering clear, gentle guidance, the instructor fosters a trusting relationship. This approach aligns with ethical guidelines for infant care professionals, which emphasize parent empowerment and a supportive learning environment. It also indirectly supports the regulatory framework by ensuring that parents are equipped with accurate information and confidence to practice infant massage safely and effectively, thereby minimizing potential risks. An incorrect approach that involves immediately correcting the parent's perceived misinterpretations without first understanding their perspective is professionally unacceptable. This can lead to the parent feeling defensive, embarrassed, or misunderstood, potentially shutting down their engagement and willingness to learn. Ethically, it violates the principle of respect for the parent and can undermine the therapeutic relationship. It also fails to acknowledge that parents may have unique concerns or learning styles that require a tailored approach. Another incorrect approach, such as dismissing the parent's concerns as unimportant or overly anxious, is also professionally flawed. This demonstrates a lack of empathy and can alienate the parent, making them less likely to seek further guidance or trust the instructor's expertise. It disregards the parent's role as the primary caregiver and their emotional investment in their infant's well-being. A third incorrect approach, which involves solely focusing on the technical aspects of massage without addressing the parent's communication style or emotional state, misses a critical opportunity to build rapport and ensure comprehensive understanding. While technical accuracy is important, effective instruction also involves creating a safe and supportive space for learning, which is heavily influenced by communication. The professional decision-making process for similar situations should involve a risk assessment that considers the potential impact of different communication strategies on the parent-infant dyad and the instructor-parent relationship. The instructor should first aim to understand the parent's perspective, then provide information and guidance in a way that is accessible, respectful, and empowering. This involves active listening, empathetic responses, and a willingness to adapt teaching methods to meet individual needs, always keeping the infant's well-being and the parent's confidence at the forefront. Question 14. Consider a scenario where during an infant massage session, you observe that the infant, who was previously alert and engaged, has become noticeably lethargic and is exhibiting a slight fever. The parent expresses that the infant has been a little off all morning but didn't think much of it. What is the most appropriate immediate course of action? Option A. Proceed with the full massage session as planned, assuming the infant is just tired and will perk up. Option B. Advise the parent to give the infant some rest and reschedule the massage for another day without further comment. Option C. Continue with a very gentle, abbreviated massage session, focusing on relaxation techniques only. Option D. Gently pause the massage, explain your observations and concerns to the parent, and recommend they consult their pediatrician before continuing. The correct answer is D. Gently pause the massage, explain your observations and concerns to the parent, and recommend they consult their pediatrician before continuing. Explanation. This scenario is professionally challenging because it requires the certified infant massage instructor, CIMI, to balance the desire to provide comfort and support to a parent with the paramount responsibility of ensuring infant safety. The instructor must make a rapid, informed decision based on observable signs and established contraindications, prioritizing the infant's well-being above all else. This necessitates a thorough understanding of when massage is appropriate and when it poses a risk. The correct approach represents best professional practice because it adheres strictly to the safety guidelines and contraindications established by the CIMI certification body. This involves recognizing signs of illness that could be exacerbated by massage or indicate a more serious underlying condition. By pausing the session and recommending consultation with a healthcare professional, the instructor acts ethically and responsibly, fulfilling their duty of care. This aligns with the core principles of infant safety and professional conduct expected of a CIMI, ensuring that the infant's health is not compromised. An incorrect approach that proceeds with the massage despite signs of fever and lethargy would be a significant regulatory and ethical failure. It disregards established contraindications for infant massage, potentially worsening the infant's condition or masking symptoms that require medical attention. This demonstrates a lack of professional judgment and a failure to uphold the safety standards inherent in the CIMI role. Another incorrect approach, such as dismissing the parent's concerns or the observable signs without further investigation, also constitutes an ethical lapse. It fails to acknowledge the potential risks and prioritizes convenience over the infant's health, violating the trust placed in the instructor. Professionals in this situation should employ a decision-making framework that begins with immediate observation and assessment of the infant's condition. This is followed by a review of established contraindications for infant massage. If any contraindications are present, the next step is to communicate concerns clearly and empathetically to the parent, explaining the rationale for pausing or modifying the session. The final step involves recommending consultation with a qualified healthcare provider for diagnosis and treatment, thereby ensuring the infant receives appropriate medical care. Question 15. The investigation demonstrates that a parent attending an infant massage education session expresses a desire to focus on specific areas of their infant's body and requests a slower pace for learning the strokes, indicating some initial apprehension about performing the movements correctly. How should the certified infant massage instructor, CIMI, best respond to this parent's expressed needs and preferences? Option A. Acknowledge the parent's requests. Adjust the demonstration and explanation to focus on the preferred areas and slower pace, and check for understanding and comfort throughout the session. Option B. Politely explain that the standard curriculum must be followed for all parents to ensure comprehensive coverage of all techniques, and proceed with the planned session pace. Option C. Suggest that the parent might benefit from observing other parents first to gain confidence before actively participating in the demonstration. Option D. Immediately demonstrate all techniques at the standard pace, assuming the parent will catch up, and offer to answer questions only at the end of the session. The correct answer is A. Acknowledge the parent's requests, adjust the demonstration and explanation to focus on the preferred areas and slower pace, and check for understanding and comfort throughout the session. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified infant massage instructor, CIMI, to adapt their teaching methods to a parent's specific learning style and comfort level while ensuring the safety and well-being of the infant. The instructor must balance providing comprehensive education with respecting the parent's autonomy and potential anxieties. The core challenge lies in effectively communicating complex, hands-on techniques in a way that is understood, retained, and confidently applied by the parent, all within the ethical and professional boundaries of infant massage instruction. Correct approach analysis. The correct approach involves actively listening to the parent's concerns and preferences, then tailoring the demonstration and explanation of infant massage techniques accordingly. This aligns with best professional practice by prioritizing the parent-child dyad's needs and fostering a supportive learning environment. It demonstrates respect for the parent as the primary caregiver and acknowledges that learning is an individual process. This approach is ethically sound as it promotes informed consent and empowers the parent to participate actively in their infant's care, ensuring they feel comfortable and competent. It also implicitly adheres to any guidelines that emphasize a client-centered and responsive teaching methodology. Incorrect approaches analysis. One incorrect approach involves rigidly adhering to a predetermined teaching script without acknowledging or adapting to the parent's expressed discomfort or requests for modification. This fails to meet the parent's individual learning needs and can create anxiety, potentially hindering their ability to learn or practice the techniques effectively. Ethically, it disregards the parent's autonomy and can be perceived as dismissive, undermining the trust essential in a caregiver-instructor relationship. Another incorrect approach is to proceed with demonstrating techniques that the parent has indicated they are not comfortable with, perhaps due to cultural beliefs or personal apprehension. This is a significant ethical failure, as it violates the principle of respecting individual boundaries and can cause distress to both the parent and the infant. It also fails to uphold the instructor's responsibility to create a safe and supportive learning experience. A further incorrect approach is to oversimplify the techniques to the point where crucial safety or efficacy elements are omitted, simply to speed up the session, or because the instructor assumes the parent will not grasp more detailed instructions. This compromises the quality of education and could lead to improper application of massage, potentially negating benefits or, in rare cases, causing harm. This is a failure in professional duty to provide thorough and accurate instruction. Professional reasoning. Professionals in this field should employ a decision-making framework that begins with active listening and empathic engagement. The instructor must first assess the parent's current understanding, comfort level, and any specific concerns they may have. This assessment should then inform the instructional strategy, allowing for flexibility and adaptation. The framework should prioritize the parent's agency in the learning process, ensuring they feel heard and respected. If a parent expresses a preference or concern, the instructor should validate it and collaboratively adjust the approach. This iterative process of listening, assessing, adapting, and confirming understanding is crucial for effective and ethical instruction. Question 16. Upon reviewing the initial intake form, a new parent expresses significant hesitation about infant massage, stating, "I'm not sure I'm coordinated enough, and I've heard it can be too stimulating for babies. I'm worried I'll do it wrong and upset my baby." As a certified infant massage instructor, CIMI, how should you best address this parent's concerns to build rapport and encourage their participation? Option A. Suggest that perhaps infant massage isn't the right fit for them at this time, and offer to provide resources on other infant care practices, implying that their concerns are valid reasons to avoid the practice altogether. Option B. Gently acknowledge their concerns, validate their feelings, and offer to demonstrate simple, calming techniques, emphasizing that the goal is connection and that there's no wrong way to connect with their baby, while assuring them that you will guide them every step of the way and that participation is entirely voluntary. Option C. Immediately reassure them that infant massage is universally beneficial and that their perceived lack of coordination is a common but unfounded worry, proceeding to demonstrate a full routine to prove its simplicity and effectiveness. Option D. Explain that most parents overcome initial hesitations quickly, and that the benefits are so significant that it's important for them to try, gently encouraging them to proceed with the demonstration despite their stated reservations. The correct answer is B. Gently acknowledge their concerns, validate their feelings, and offer to demonstrate simple, calming techniques, emphasizing that the goal is connection and that there's no wrong way to connect with their baby, while assuring them that you will guide them every step of the way and that participation is entirely voluntary. Explanation. This scenario presents a common challenge for certified infant massage instructors, CIMI, where a caregiver expresses skepticism and resistance to the core principles of infant massage. The professional challenge lies in balancing the instructor's expertise and the evidence-based benefits of infant massage with the caregiver's autonomy and potential underlying concerns. CIMI must navigate this situation with empathy, respect, and a commitment to providing accurate, non-judgmental information, all while adhering to ethical guidelines that prioritize the well-being of the infant and the establishment of a trusting relationship with the caregiver. The correct approach prioritizes building rapport through active listening, validation, and offering evidence-based information in a non-coercive manner. This aligns with the ethical imperative for CIMI to foster a supportive and educational environment. By acknowledging the caregiver's feelings and offering gentle, informative guidance, the instructor demonstrates respect for the caregiver's role and concerns, which is crucial for establishing trust and encouraging engagement. This approach respects the caregiver's right to make informed decisions about their child's care, a fundamental ethical principle. An incorrect approach that dismisses the caregiver's concerns or insists on immediate compliance fails to build rapport and can alienate the caregiver. This can lead to a breakdown in communication and a missed opportunity to educate the caregiver about the benefits of infant massage. Such an approach may be perceived as patronizing or dismissive, violating the ethical principle of respecting the caregiver's autonomy and potentially creating a barrier to the infant receiving the benefits of massage. Another incorrect approach that involves pressuring the caregiver or making them feel inadequate for their initial hesitation is also ethically unsound. It undermines the supportive role of the CIMI and can create anxiety for the caregiver, which is counterproductive to fostering a positive bonding experience through infant massage. Professionals should approach such situations by first actively listening to understand the root of the caregiver's skepticism. This involves asking open-ended questions and reflecting back their concerns to ensure understanding. Following this, the instructor should validate their feelings, acknowledging that it's natural to have questions or reservations. Then, they should offer clear, concise, and evidence-based information about infant massage, focusing on the benefits for both infant and caregiver, and importantly, emphasizing that participation is voluntary and can be adapted to their comfort level. The goal is to empower the caregiver with knowledge, not to force compliance. Question 17. System analysis indicates that during an infant massage session, a caregiver reports their infant has suddenly become unusually lethargic, is refusing to feed, and is exhibiting shallow breathing. The infant's skin appears pale and cool to the touch. What is the most appropriate immediate course of action for the certified infant massage instructor? Option A. Immediately cease the massage, comfort the infant and caregiver, and advise the caregiver to seek immediate medical evaluation from a pediatrician or emergency services. Option B. Reassure the caregiver that these symptoms are common during infant massage and suggest a short break before resuming the session. Option C. Ask the caregiver if they have any over-the-counter infant pain relievers they could administer before continuing the massage. Option D. Continue the massage with gentle strokes, assuming the infant is simply tired or overstimulated, and suggest the caregiver offer a feeding after the session. The correct answer is A. Immediately cease the massage, comfort the infant and caregiver, and advise the caregiver to seek immediate medical evaluation from a pediatrician or emergency services. Explanation. This scenario presents a common yet critical challenge for a certified infant massage instructor, CIMI, responding to an infant's sudden distress during a session. The professional challenge lies in the immediate need to assess the situation, differentiate between a minor discomfort and a potential medical emergency, and act decisively while maintaining a calm and supportive environment for both the infant and their caregiver. The instructor must balance their role as a facilitator of infant well-being through massage with their responsibility to recognize and respond appropriately to signs of distress that may require medical attention. The correct approach prioritizes the infant's immediate safety and well-being by recognizing the severity of the symptoms and taking prompt action to seek professional medical help. This aligns with the CIMI ethical obligation to act in the best interest of the infant and to operate within the scope of their training. CIMI certification implies a foundational understanding of infant health and safety, including recognizing when to escalate care. This approach demonstrates responsible practice by not attempting to manage a potentially serious medical issue beyond the scope of infant massage instruction. An incorrect approach that involves continuing the massage despite clear signs of distress is a significant ethical failure, disregards the infant's immediate needs, and could exacerbate a developing medical condition. This action violates the principle of do no harm and demonstrates a lack of professional judgment in recognizing the limits of infant massage. Another incorrect approach, such as solely relying on the caregiver's initial assessment without independent observation and action, is also problematic. While the caregiver's input is vital, the CIMI has a professional responsibility to observe the infant directly and to intervene if their professional judgment indicates a need for medical attention, regardless of the caregiver's immediate reaction. This failure stems from an abdication of professional responsibility and a potential misinterpretation of the CIMI role. The professional decision-making process in such situations should involve a rapid assessment of the infant's vital signs and behavior, a clear understanding of what constitutes normal infant responses versus concerning signs, and a pre-established protocol for emergency situations. This includes knowing when and how to contact emergency medical services and how to provide clear, concise information to both the caregiver and responding medical professionals. Professionals should always err on the side of caution when infant health is concerned. Question 18. Examination of the data shows a parent attending an infant massage class expresses significant anxiety about a common childhood rash, stating they heard it could be aggravated by touch and are hesitant to proceed with the massage demonstration on their infant. What is the most appropriate initial response for the certified infant massage instructor CIMI? Option A. Acknowledge the parent's concern with empathy. Explain that infant massage is generally beneficial for skin health and comfort, and offer to share reputable resources on common infant skin conditions and safe massage practices, while gently clarifying the CIMI role is not medical advice. Option B. Reassure the parent that their concern is unfounded and proceed with the massage demonstration, emphasizing that infant massage is always safe and beneficial for all skin types. Option C. Suggest that the parent research the rash themselves online and return to the class when they have more information, without engaging further with their current concern. Option D. Immediately advise the parent that the rash sounds serious and recommend they see a pediatrician before continuing with the class, without offering further explanation or support. The correct answer is A. Acknowledge the parent's concern with empathy. Explain that infant massage is generally beneficial for skin health and comfort, and offer to share reputable resources on common infant skin conditions and safe massage practices, while gently clarifying the CIMI role is not medical advice. Explanation. This scenario presents a common challenge for certified infant massage instructors, CIMI, where a parent expresses a concern rooted in misinformation or personal belief that may not align with established infant care practices or the scope of infant massage. The professional challenge lies in addressing the parent's anxiety and providing accurate, reassuring information without dismissing their feelings or overstepping professional boundaries. It requires a delicate balance of empathy, knowledge, and adherence to professional guidelines. The correct approach prioritizes the parent's well-being and the infant's safety by seeking to understand the root of the concern and providing evidence-based information within the CIMI scope of practice. This aligns with the ethical imperative to act in the best interest of the child and to provide accurate, non-medical advice. By validating the parent's feelings and offering to share reliable resources, the CIMI demonstrates professionalism, builds trust, and empowers the parent with knowledge, ultimately promoting a positive and safe experience with infant massage. This approach respects the parent's autonomy while upholding professional standards. An incorrect approach that dismisses the parent's concern outright is professionally unacceptable because it fails to acknowledge the parent's emotional state and can erode trust. It also risks alienating the parent and preventing them from seeking further clarification or support. Ethically, it demonstrates a lack of empathy and a failure to adequately address a parent's expressed worry, which is counter to the supportive role of a CIMI. Another incorrect approach that involves offering medical advice or making diagnostic statements is a significant regulatory and ethical failure. CIMI are not medical professionals and are prohibited from diagnosing, treating, or advising on medical conditions. Doing so constitutes practicing outside the scope of their certification and could lead to harm if the parent relies on unqualified advice instead of seeking appropriate medical care. This violates the principle of not causing harm and exceeds the defined boundaries of the CIMI role. A third incorrect approach that involves ignoring the concern and proceeding with the massage without addressing it is also professionally unsound. This demonstrates a lack of attentiveness to the parent's needs and can create an environment of discomfort and distrust. It fails to uphold the CIMI responsibility to ensure the parent feels heard and understood, which is crucial for a positive learning experience and for the overall well-being of the infant and family. The professional decision-making process for similar situations involves active listening to fully understand the parent's concern, validating their feelings without necessarily agreeing with their premise, and then responding with accurate, evidence-based information that is within the CIMI scope of practice. If the concern touches upon medical issues, the professional response is to gently guide the parent towards consulting their healthcare provider. Building rapport and maintaining open communication are paramount. Question 19. Performance analysis shows that a certified infant massage instructor, CIMI, is scheduled to conduct a session with a 3-month-old infant. Upon arrival, the instructor observes that the infant is visibly lethargic, has a slight cough, and the caregiver mentions the infant has had a low-grade fever for the past 24 hours. The CIMI has been trained on the established contraindications for infant massage. Which of the following actions best upholds the professional and ethical responsibilities of the CIMI in this situation? Option A. Proceed with a gentle, modified massage focusing only on non-affected areas, assuming the symptoms are mild. Option B. Postpone the infant massage session and advise the caregiver to consult with their pediatrician if symptoms persist or worsen. Option C. Inform the caregiver that infant massage is generally safe and proceed with the full massage routine as planned. Option D. Suggest the caregiver administer over-the-counter infant pain relievers before the massage to alleviate symptoms. Correct answer is B. Postpone the infant massage session and advise the caregiver to consult with their pediatrician if symptoms persist or worsen. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified infant massage instructor, CIMI, to make a critical judgment call regarding the safety and well-being of an infant. The instructor must balance the desire to provide the benefits of infant massage with the absolute necessity of avoiding harm. This demands a thorough understanding of contraindications, the ability to observe subtle infant cues, and effective communication with the caregiver. The instructor's decision directly impacts the infant's health and the caregiver's trust. Correct approach analysis. The correct approach prioritizes the infant's immediate health and safety by recognizing the contraindication and delaying the massage. This aligns with the core ethical principles of infant massage instruction, which emphasize do no harm. Regulatory frameworks for infant massage instruction, while not always codified as strict laws in the same way as medical practice, are built upon established guidelines and best practices that universally advocate for caution when an infant exhibits signs of illness or discomfort. The CIMI responsibility is to assess the infant's condition and act in the infant's best interest, which includes postponing the massage until the infant is well. This demonstrates adherence to professional standards and a commitment to the infant's welfare. Incorrect approaches analysis. One incorrect approach involves proceeding with the massage despite the infant's symptoms. This is a direct violation of the do no harm principle and disregards established contraindications for infant massage, such as fever or acute illness. Ethically, this is negligent and could exacerbate the infant's condition. Regulatory guidelines for CIMI would unequivocally condemn this action as it places the infant at risk. Another incorrect approach is to dismiss the caregiver's concerns or the observed symptoms as insignificant and proceed with the massage. This demonstrates a lack of professional judgment and empathy, failing to acknowledge the potential seriousness of the infant's condition. It undermines the caregiver's trust and disregards the instructor's duty of care. Such an approach would be considered a failure to uphold professional standards and ethical responsibilities. A third incorrect approach is to offer a modified massage without a clear understanding of the infant's specific condition, or without consulting with a healthcare professional if the symptoms are concerning. While modification is sometimes appropriate, doing so without proper assessment or guidance when contraindications are present can still be risky. The CIMI role is not to diagnose or treat, but to recognize when massage is contraindicated and to advise accordingly, which may include recommending consultation with a pediatrician. Professional reasoning. When faced with a situation where an infant exhibits signs of illness, a CIMI should follow a structured decision-making process. First, observe the infant's behavior and physical signs carefully. Second, listen attentively to the caregiver's observations and concerns. Third, consult the established contraindications list for infant massage. Fourth, if any contraindications are present, the professional decision is to postpone the massage and advise the caregiver to monitor the infant and consult a healthcare provider if symptoms persist or worsen. Fifth, document the decision and the reasoning. This systematic approach ensures that the infant's well-being is always the paramount consideration, upholding both ethical obligations and professional standards. Question 20. Cost-benefit analysis shows that while parents often seek infant massage to alleviate immediate fussiness, the true value lies in its long-term impact on infant development. A parent expresses frustration, stating, "My baby is so fussy, I just need something to make them stop crying now. As a certified infant massage instructor, how should you respond to best support the infant's developmental needs and uphold professional standards? Option A. Suggest a specific massage stroke that is known to be very relaxing and tell the parent to use it repeatedly until the baby stops crying, assuring them it will be effective for immediate fussiness. Option B. Explain that while immediate fussiness relief is a potential benefit, the primary focus of infant massage is on fostering secure attachment, regulating the infant's nervous system, and promoting sensory exploration, all of which contribute to overall healthy development and can indirectly lead to a calmer, more content infant over time. Option C. Recommend a series of vigorous massage techniques designed to stimulate the infant and distract them from their discomfort, explaining that increased activity often leads to eventual sleep and quiet. Option D. Advise the parent that infant massage is primarily for muscle relaxation and physical comfort, and if the fussiness persists, they should consider other methods like medication or consulting a pediatrician for a more direct solution. The correct answer is B. Explain that while immediate fussiness relief is a potential benefit, the primary focus of infant massage is on fostering secure attachment, regulating the infant's nervous system, and promoting sensory exploration, all of which contribute to overall healthy development and can indirectly lead to a calmer, more content infant over time. Explanation: this scenario is professionally challenging because it requires balancing the immediate perceived needs of a parent with the established, evidence-based understanding of infant development and the ethical responsibilities of a certified infant massage instructor, CIMI. The parent's desire for a quick fix for their infant's fussiness, while understandable, may not align with the nuanced and long-term benefits of touch. A CIMI must navigate this by educating the parent, setting realistic expectations, and prioritizing the infant's well-being and developmental needs over a superficial, short-term solution. The correct approach represents best professional practice because it prioritizes the infant's holistic development, which is the core purpose of infant massage instruction. By focusing on the role of touch in building secure attachment, regulating the infant's nervous system, and fostering sensory exploration, the CIMI is adhering to the principles of infant well-being and providing education grounded in developmental science. This approach aligns with the ethical guidelines of promoting positive parent-infant interaction and empowering parents with knowledge that supports their child's long-term growth, rather than offering a simplistic, potentially ineffective, or even detrimental quick fix. An incorrect approach that focuses solely on immediate fussiness reduction without addressing the underlying developmental benefits fails to uphold the CIMI professional mandate. This could lead to a superficial understanding of infant massage, potentially causing the parent to abandon the practice if immediate results are not achieved, thereby missing out on crucial developmental opportunities for the infant. Ethically, it is a failure to provide comprehensive and accurate education. Another incorrect approach that suggests using massage as a passive distraction technique, rather than an interactive and responsive process, disregards the importance of the parent-infant connection. This undermines the very essence of infant massage, which is about fostering communication and bonding through touch. It also risks misinterpreting the infant's cues, potentially leading to overstimulation or a lack of responsiveness to the infant's needs. A further incorrect approach that emphasizes only the physical benefits of massage, such as muscle relaxation, without integrating the emotional and social aspects, presents an incomplete picture. While physical relaxation is a benefit, it is the integration of touch with emotional connection and sensory development that yields the most profound and lasting positive impacts on an infant's overall well-being. This narrow focus fails to leverage the full potential of infant massage as a tool for nurturing development. The professional decision-making process for similar situations involves a commitment to evidence-based practice, ethical conduct, and client education. A CIMI should first actively listen to and validate the parent's concerns. Then, they should gently reframe the situation by explaining the broader, long-term benefits of infant massage, focusing on developmental aspects. They should then collaboratively develop a plan that addresses the parent's immediate concerns, while ensuring the instruction aligns with best practices for infant well-being and development. This involves setting realistic expectations and empowering the parent with knowledge and skills that foster a secure and nurturing relationship with their infant.